We start with the COVID-19 situation in South Korea. The country on Monday expects to see yet another record number of new COVID-19 infections.
This comes as the country's top health authorities are set to release guidelines regarding the fourth vaccine shot. For more on this, our reporter Shin Ye-eun is in the studio with us. Good morning, Ye-eun.
Good morning.
So, like always, let's start with how many infections are we expecting for today?
Sure, so we're expecting to see another record high on this Monday, and Monday's daily tally will most likely hover in the high 50,000s. As of 9 p.m. Sunday, 53,390 infections were reported, and this was nearly twice as many cases reported compared to a week ago. The number of new COVID-19 infections has been doubling over the past few weeks due to the spread of Omicron. Just a month ago, we were seeing tallies consistently in the 3,000 or 4,000s. Now we're seeing daily figures above 50,000 a day. The number of critically ill patients is in the 200 range, which isn't putting pressure on the country's medical capacity just yet, although authorities are keeping a watch on the number of people over 60 who have been newly infected with COVID-19. And last week, the number of infected people in that age group went up 2.6-fold from a week before, mainly because of cluster infections spurring from senior care facilities.
Now, South Korea's strategy to try and tackle the spread of Omicron as much as is possible, considering how virulent it is for the population to test and treat themselves at home. But from Sunday, they kind of modified the rules somewhat because they are banning the sale online of these antigen testing kits.
That's exactly right. From Sunday, the government banned online sales of test kits to prevent scalping at marked up prices. In consideration of leftover stock, though, there will be a grace period up to the 16th, meaning that technically people can buy kits and sell kits online until Wednesday. And authorities introduced the measure to prevent a few individuals from excessive stockpiling. Officials have also limited the number of kits one can buy offline, for instance, at pharmacies and convenience stores, to only 5 kits per person. Now, there won't be any restrictions preventing people who choose to buy more than 5 by visiting multiple stores. Notwithstanding this latest measure kicking off from Sunday, many said kits were selling like hotcakes. Take a listen to what one pharmacist had to say.
I was receiving calls all day on how many kits are left. Today I have 200 ready in stock, but by 1 or 2 p.m. they'll all be sold out.
Now, apart from, limiting how many kits an individual can buy and online sales of these kits, are there any other ways that the government is trying to provide enough self-kits for everyone?
Authorities are expanding the number of kits that are to be distributed to pharmacies and convenience stores nationwide. Starting Monday until February 28th, the Ministry of Food and Drug Safety will distribute a total of 30 million test kits nationwide. During the same period, an extra 24 million kits will be supplied to testing sites and for individuals at high risk, like those in senior care centers, and this for free of charge. In March, the country will add a total of 190 million self-test kits for both the private and public sector, which is actually twice the amount from February. And this comes as Prime Minister Kim Boo-kyum reportedly held a meeting with representatives of rapid antigen test kit manufacturers on Sunday, and this includes the CEOs of SD Biosensor and GenBody. The Prime Minister asked the CEOs to expand production, as these kits are a key part of the country's latest COVID-19 strategy.
Now, in the coming hours, authorities here in South Korea are going to release guidelines about who should receive a fourth booster shot. Do we have any idea yet who exactly is going to be eligible for it?
Well, not any specifics have been revealed just yet, but we're expecting those with weak immune systems or those admitted to senior care facilities to be eligible. Also, the fourth COVID-19 vaccine shot is expected to be administered 4 months after the third shot, and administration is set to start from the end of this month. Also, in regards to vaccination, I'd like to add that the country will start providing Novavax vaccines from this Monday, and Novavax is the 5th vaccine to be licensed in Korea. It's set to be administered to those over 18 years old who haven't been vaccinated or who haven't had the booster shot due to side effects.
All right, Ye-eun, thank you so much for your report. We'll talk to you again tomorrow.
Thank you so much.